Hello, my name is Jessica Kerstetter, and I'm joined by Ivana Kohut and Erin Jarvis, and we are presenting our project titled The Effect of COVID-19 on Caregiver Report of Behavioral Health Symptoms in Children. With schools moving to remote learning, the isolation of social distancing, anxiety surrounding an unknown illness, and a growing economic burden on families, the COVID-19 pandemic has created a new source of stress for developing children. The goal of our project is to examine how the COVID-19 pandemic has impacted parental reports of children's behavioral health alongside various impacts on the family. We began with a literature review that identified several risk factors that negatively impact child well-being and behavioral health. Displayed in Figure 1 are some of the identified risk factors, including ACE scores of 4 and greater, increased economic burden, social isolation, and barriers to mental health treatment. With this project, we attempted to quantify the impact of these risk factors in the setting of a global pandemic.
Methodologically, 428 participants were selected from the North Philadelphia region, ages 6 to 11, and they were enrolled during well visits between July 2019 and March 2020, during which caregivers completed the Pediatric Symptom Checklist 17 survey assessing the frequency of internalizing, externalizing, and attention symptoms. Between July and November 2020, caregivers of previously enrolled patients completed 2 questionnaires by phone, 1, a repeat of that Pediatric Symptom Checklist 17, and 2, the Coronavirus Impact Scale. When analyzing data, differences in matched total scores and internalizing, externalizing, and attention symptoms for before versus during COVID were calculated with associated normal distributions. The association between the CIS scores and categorical changes were determined by linear regression. In our analysis, symptom reports were categorized as high risk if total scores exceeded or were equal to 15, externalizing scores exceeded or were equal to 17, internalizing scores exceeded or were equal to 5, and attention scores exceeded to or were equal to 7. As for results, 140 caregivers completed the 2019 and 2020 surveys. Mean differences from before and after March 2020 in the child symptomatology by category with associated 95% confidence intervals are presented in Figure 3.
Our data illustrate that, in general, children exhibited more behavioral symptoms during COVID compared to their pre-COVID baselines. Figure 4 illustrates the number of children who changed from a low to high-risk pediatric symptom score during COVID. For total pediatric symptom scores, the number of children deemed as high risk increased by 16% from their pre-COVID baseline. Those with high risk internalizing, externalizing, and attention subscale scores also increased. Figure 5 illustrates changes in pediatric symptom risk status and correlated changes in the COVID impact scale across time. With regards to internalizing, attention, and total pediatric symptoms, children who did not change from low to high risk status had significantly lower COVID impact scores than children who increased to a high risk status during COVID. In summary, the COVID-19 pandemic has had a significant impact on children, as illustrated by an increased report of behavioral health symptoms, particularly internalizing symptoms like feeling sad, unhappy, or worried, as well as attention symptoms like difficulty paying attention and concentrating. Additional screening for these symptoms in children may be important to incorporate into routine care visits throughout the pandemic and into its recovery.
Thank you for your attention.